So I enter into the room. I give a mark sheet to the examiner with a smile. The examiner is telling, do the lower motor neuron examination of neurology examinations. So I listen to my command. Suppose the child is Robert and his mother is Alexandria. So I wash my hand. I'm introducing myself. Hello, this is Dr. Emma. One of the candidate today. I want to examine your lower limb. So I take my permission, introducing. So hello, Robert. How are you? How old are you? Okay. So how can you come today? Whom come with you? So this time actually I am checking his mentality. Like any submental, among them dysmorphic, any features, device, and distress. So I find that the child is well communicating, but he is still on nappy. There is a catheter present. I look at this head size and shape. There is any shunt present or not, because he is on urinary catheter and he is a bedridden. Then I shake his handshake with him and tell him, give you a beautiful smile. Then I will look at his face. Is there any facial nerve palsy or any eye abnormality like squint, nystagmus, anything? Then I am going to his leg. I am telling that can you expose his leg? So I find that he cannot do that. I tell the mother, remove his shoe socks. He actually lying on the bed. So I'm telling mom, asking mom, can he walk? Can he stand for me? So he cannot stand. So he cannot walk. Okay. So I understand leg gait I cannot. I tell that I want to see the back. The back I am going back. I find lower of the back there is a scar for correction of spina bifida. So I understand my case is spina bifida. Though then I am going to the inspect his leg inspection. Then both hand I am measuring his both leg, that any symmetry present or not. Both leg are symmetrical. Maybe wasting present, inspection I do, and then tone, ruling both leg and flexion extension of the both leg. Also the ankle joint I am doing. So tone very much hypotonic. He's very hypotonic. Then I am going to the power against the gravity. Can you raise? So it is below 3, just 1 power, maybe flickering. I don't find very hypotonic and hypotonic severely and hyporeflexia. There is no any reflex I find. Ankle, knee and Babinski I done it. Okay. Then I tell him, can you do the heel shin test? I'm showing he can't do that. Then I tell that I want to examine his upper limb, just power I want to do. So power accordingly I check and I find I will pass comment. So I'd like to complete my examination doing the full neurological examination, cranial nerve examinations, abdomen examination. Is there is any any constipation, fecal mass and shunt ending? I would like to complete examination to do the anogenital examinations, because any petulous anus, these are I want to do. Okay. So so the examiner telling, present your case. Today I examine Ali Robert. Robert is an 11 years age old boy. He is well communicating. He is bedridden. He cannot walk, and his back I find there is a scar marks, correction of surgical scar marks, maybe any spina bifida, and also he is severely hypotonic, hyporeflexia, no any reflex I find. Heel shin test he can't do the coordinations. And upper limb power I tell, his power is very reduced, maybe 1, severely hypotonic, hyporeflexia. And I tell in the examine, I postpone the sensations, later I will do. If I get time, within 6 minutes I will do the sensations. The small toe, big toe, leg and the knee. Okay. So so putting together, it is a case of spinal bifida. My top diagnosis, it can be DD or spina. If there is no any scar marks, then what we tell bedridden cases, DD. I am telling you, spina bifida, upper motor neuron lesion and lower motor neuron lesions. Upper motor neuron lesion bedridden are like diplegia, hemiplegia, double hemiplegia and quadriplegia. Lower motor neuron lesion, spina bifida, where the clue is back scar and also there is urinary catheter and child is still on nappy. Spina muscular atrophy type 2 is another DD, where tongue fasciculations and Duchenne muscular dystrophy advanced stage. It can be also fine, but Duchenne we find there is calf muscle hypertrophy. And about GBS is all bedridden can become, but GBS what we find, there is a short history of gastroenteritis. They give that. After that the child has a rapid development of paralysis. Okay. unable to walk for 2 days, 3 days, like that, acute history. So examiner is telling, suppose it is a case of spina bifida, how can you manage that? So first of all, after examination, I will take his history, revise his notes, what investigation already done. I will run some test. What the test I will do? Investigations. I will do the spina bifida, urinary tract infections, urinary you can do. This is on spina bifida, or according to any complications we will do that. Shunt check, examine him shunt. These are and abdomen examination we will do, because they have feces. Then management, first of all we give the management spina bifida. If UTI problem, then prophylactic antibiotic, intermittent catheterizations, and oxybutynine. If constipation is a complication, so constipation, for that we what we do, constipation we are giving the fluid, enough fluid, fiber diet, high rich fiber diet, and we'll go for shunt, take care, and any infections. Also give the advice, like if in shunt, like severe headache, blurring of visions, this happened, then seek the medical advice. We give the advice like avoid hot object, for bed sore, change the position of the child, and avoid latex. These are advice we give. And seek medical advice. If child has severe headache, shunt, that may be cause of headache are shunt, over drainage, shunt blockage, infections. These are, and abdominal pain is occur because of urinary tract infection, constipation, peritonitis. Blood pressure, ECG, these are random blood sugar, these are we to do the bedside test. Okay. So the DD, we can say spina bifida, spinal muscular atrophy type 2, remember advanced DMD, Guillain-Barré syndrome. These are the bedridden case. If it is bedridden, keep this DD in your mind.